Like the implant was 100 times easier, and that was like cakewalk. The thing I love about implants for patients is that you were able to fix a tooth to where it almost acts like a normal tooth. Patients come in missing teeth or having to lose a tooth, and we're able to replace that as close as we can to their natural return. Other thing we love about implants is being able to, replace multiple teeth, whether it's one, two, all the teeth with implants. They're a very great tool to be able to fix missing and broken teeth. There's not necessarily an ideal candidate for implants. Most people can benefit from implants as long as the bone is there. Most patients are able to, with the invention of short implants, long implants, narrow implants, that we're able to do implants on everybody from the youngest is about 20 up until the oldest I've placed in is 85 years old. So there's not necessarily an ideal patient, but the best case scenario is one missing tooth or an issue like that, and you're able to fix it really quick and really easily. Some of the tools that set our treatment process is when I built this, we invested in 3D scanners so we can be able to come up with great surgical guides, cone beam CTs, which allow us to do a 3D x-ray so we know exactly how much bone is there, where the bone is there. We can plan the case perfectly so we know the outcome is exactly as we want. The way a treatment on an implant works is generally, if the patient's already missing the tooth, what you would do is we would start with a free implant consult, come in, we take a 3D scan, we take an intraoral scan, we're able to mesh those together to be able to figure out exactly where the implant is. At that point, it's just a lot of doctor backside work, creating a surgical guide, printing it in-house, making sure everything is good there, and then we bring back the patient for the actual day of surgery. It is a surgery in the sense, but it really is only about a 45-minute to 1 hour outpatient, really easy procedure. We go in there, we move the gums away a little bit and create some pilot holes, and we're able to place that implant into the bone. Then we like to let that heal about 3 or 4 months afterwards. So you're still missing that tooth in that time, but in that time that implant is becoming part of the bone and osseointegrating. And then in about 3 to 4 months, we bring it back, take another scan, and be able to make the crown that generally goes right in. Nice thing is we're able to do it with all impressions, 3D impressions, so we're not having to put the goo in the mouth or anything like that. Biggest common misconception I hear is that it's painful and that the surgery is really intense and really in-depth, when in reality it takes us longer to kind of get set up for it than it does to actually do the procedure. Pain-wise, every patient I've talked to after I placed implants versus the tooth having to come out, they're like, the implant was 100 times easier, and that was like cakewalk. Other misconception is that the price, or it's super expensive, can't be afforded, but also kind of a misconception. Most dental insurances now are providing a lot of coverage for implants, and we're also able to work on pricing and work on being able to do payment plans or work with some kind of issue if we need to. What makes me a trusted expert is I was trained by some of the best implantologists. People have been placing implants since the 80s. I began placing implants in 2014. I've spent over 100 hours doing continuing education on live patients, models, all kinds of different issues. I've done enough implants to where I know what issues can arise, how to treat those issues, and we just have the correct tools to be able to plan a safe procedure. The nice thing about doing dental implants here is it's a really comfortable situation. It's an area that we're able to, one, place the implant, and two, do the crown as well. We're able to save time, save money. We're able to, if patient desired, bring in an anesthesiologist to where you're asleep during the procedure if that's something that interests you. We also have 2 doctors here that do implants, so we're able to get you in on a timely manner and really help you out.